Is every patient always happy? Absolutely not, And this is a problem. There's no guarantee of any particular visual outcome. You do everything you possibly can to try and optimize the care and try and give the patient the best possible vision and give them realistic expectations, because that's really important as well. But strangely enough, the eye behaves in different ways with different people. One of the problems we have is that the calculations to try and work out your lens power, there is a margin of error in them. We've got to work out where your lens sits inside your eye. If it sits further forward, it's stronger. If it sits further back, it's weaker. And so we take measurements of the length of the eye and the curvature of the cornea in order to give us an idea about where your lens will sit inside your eye. Obviously, this is based on physics, on maths, on calculations, and on populations. But you're an individual, so your eye, the lens could sit slightly further forward, which makes it stronger. Or if it's further back, it makes it weaker. So we could leave you slightly long or slightly short-sighted. Astigmatism as well, which is the curvature of the cornea and the rugby ball shape. I know in my series of thousands of cases that if I operate on the right eye, I induce 0.2 diopters of astigmatism. If I operate on the left eye, I induce 0.3 diopters of astigmatism, and that's through my audit. But in some people, it's a lot more than that, and that messes things up for us. And that is all because you're an individual and you can't predict biology fully, and different people heal differently. So whereas in one patient I can induce astigmatism of 0.3, in another patient it could be 0.75, and that can mess up the visual quality. It's impossible to predict, but the reason why people come to me is I keep on going until I can get you as good as we possibly can. Glare is also another thing. The multifocal lenses, which I used to use, give lots of glare and cause problems. The newer lenses that I prefer, the enhanced monofocal lenses, do give a bit more glare, and some people do struggle a little bit with night driving because of it, but people do adapt to it. Mostly patients are happy, otherwise I wouldn't be doing this business and I wouldn't carry on. I'm not sure I could carry on if lots of patients were unhappy, but there are some patients who don't achieve the outcome that I want them to, and that is very, very frustrating indeed. Often because of simple things like the calculations don't predict their eyes, or their cornea behaves a bit differently. Complications are gutting, but really, really rare. It's more often that people don't get the vision that we wanted them to get, which is why I always make sure that they know they get functional reading vision, which means that we've got a bit of a get out clause, because some people are reading minuscule print and some people are reading larger print. I also tell people, factor in, if you're going to sit down and read War and Peace, factor in the fact that you'll probably require reading spectacles. So no, not everybody's happy, but I do try and keep on working with them in order to get them happy at the end of it all, because that's how I do my business. I keep patients happy, and then I get more and more personal recommendations. And I think, my motto is be kind to patients. And that means be kind to them, explain things to them, hold their hand both physically and metaphorically throughout proceedings. Make sure you do the very, very best for them and look after them afterwards as well. And if things aren't exactly how they want it to be, then that's fine, but you try and get them as best as you possibly can. But sometimes there's only so much you can do. You can't guarantee perfection, and you cannot achieve perfection. The only way to achieve perfection is to go back to when you were 18, you had your native lens, which was clear, elastic, so you could see distance and close up, and we cannot achieve that. So it's about realistic expectations. And if you keep the expectations realistic, look after a patient properly, talk to them and explain things to them. And if things don't go to plan, explain why, then I think you can keep happy patients. Unhappy patients break my heart. I hate it. I really pride myself in my customer service, and I really don't like it if people are unhappy. But you can't please everybody all the time. And I have had complaints about things because some patients, you never blame the patient, but some people are really difficult and have unrealistic expectations and imagine that we can wave a magic wand at them and get them better, but it's not the case. But again, complaints is part and parcel of their daily life and work. But thankfully it's few and far between. But if I do get a complaint, I really, really hate it. But so I try and keep my patients happy, and the vast majority are very, very happy.